Hello, Diaz here, founder owner Greenwood Dental. Today I'm talking about geriatric dentistry. And I'm sure I'm going to be making more than one video on that. I just want to come forward and let everybody know what to expect if you have a senior or an advanced aged family member that would need dental work or dental services. Geriatric dentistry could be challenging depending on the medical condition of that patient, meaning that whether they are wheelchair bound, whether they are on bed restrictions. I have done hospice visits in the past in my career to patients that needed dental care, or even the care providers, which are the nurses, had a lot of questions regarding, how to take care of their dry mouth, how to brush their teeth, how to make sure that they're not in pain, how to make sure that there's no infection or anything that will risk the chance of infection. So to answer the question, yes, we do see advanced senior citizens in our practice. I think the most advanced in years is 103, maybe 105. And I think the youngest of that generation are maybe 86 in our practice. So we do see a large average of ages, and with that comes their challenges, whether medical challenges or home care challenges or residential challenges, their accessibility to better habits or tools, or even nurses that have a better background of what to look for as far as their mouth is concerned. Now, if you have somebody, a relative or a loved one that needs immediate help or care, our facilities will accommodate obviously a wheelchair, and also our chairs can be flipped around the headrest to accommodate somebody who is in a wheelchair, so we don't have to move them in the chair. I have done dental services on patient that had ALS, a patient that had severe MS, patient that just, like I said, wheelchair bound. And they, believe it or not, they are the best patients. They really appreciate everything that you do. They're very, very cooperative. They are some of them are very funny. So don't be afraid or don't be nervous to reach out to us and let us know if you know somebody that needs help. What we would do will accommodate, like I said, that patient, because it takes time to bring them in, and it takes time to figure out their medical history and their medications, and especially if we need clearance from their specialists, whether it's cardio, neurology, pulmonary, and what we'll do, we'll reserve enough time for us to spend with the patient, with the caregiver, in order to figure out how we're going to approach their condition or how we're going to service their needs. So typically when they come in, again, that's the longest procedure. We try to get as much as possible in that appointment, because we know how challenging and how tough the transportation part of it. But sometimes they need to come back and to get more services done depending on the condition they're at. We do also offer fluoride trays for them to soak at nighttime. We offer many different tools, many different applications that the nurses or the caregivers can do at home to keep the teeth healthy, lubricated, hydrated. And the best thing to approach cases like that is by preventative. as much preventative as possible you can do for them, the better off they are. Prevent decay from happening, prevent a broken tooth from getting abscess, prevent infections. Because as you know, and as I talked about in previous videos, the head and neck is connected to your lymphatic system and your vascular system. So any contamination, like an abscess or even just as simple as gum infection, will contaminate their system and will compromise their system on top of everything that they're going through. So yes, we do see and service in our practices, all three practices, advanced years seniors, which we love. And we have serviced many retirement homes in the area that they are close by, and that's one of the things we try to do when we establish our brand. As far as location, we make sure it's close to schools, make sure it's close to our retirement homes, residential or even commercial, so we can include everybody in the community and have our offices within very easy access. So if you guys have any questions, like I said, or concern about a senior member of your family or somebody that you know of, please reach out to us. And we have all the amenities to accommodate them, and we've been doing that since 2013. So I hope this helped. It's just a brief summary of our philosophy, of our approach. I'm sure I'm going to be making more videos regarding geriatric dentistry, the technical part of it, which includes dentures, tooth replacement, denture repair, and denture care, and recommend tooth extractions, when do we recommend root canals, whether some of them are good candidate for implants or not, and when we kind of draw the line as far as invasive procedures. So I hope this helped, and I hope this answers some of your questions and your concern. And please be well, be safe. We love you all, and DS out.